Level 1 on the Rancho's Los Amigos cognitive scale is no response to pain, touch, sound, or sight. So the patient will likely just sit there as you're asking them questions. Level 2 is generalized reflex response to pain, so they will only respond when there's a sharp stimulus on them. Level 3 is localized response, so they can blink, turn away, turn toward, and respond to discomfort, but there won't be a lot of response to commands. And level 4 is confused and agitated, so they will be alert and likely aggressive or have interesting behaviors, and their behavior is not purposeful.
Level 5 for the Rancho Los Amigos scale, the patient will show increase in consistency with following and responding to simple commands, but their responses are non-purposeful and random to more complex commands. They have some verbalization, but it's inappropriate, and they can perform tasks if it's modeled first. Their memory is still severely impaired, and they can show agitation at unpleasant stimuli. For level 6, they're able to follow simple commands consistently, able to retain learning for familiar tasks. They demonstrate an increased awareness of self, and their responses may be incorrect to secondary to memory impairments. And then for level 7, they are oriented in familiar settings. They're able to perform daily routines automatically. They demonstrate carryover for new tasks. They can be superficially aware of their diagnosis but unaware of the specifics. They continue to demonstrate a lack of insight and decreased judgment, and they're beginning to show interest in social and recreational activities, but still require at least minimal supervision.
Okay, for level 8, that is purposeful, appropriate with standby assistance. They have a response that's adequate for familiar tasks, and they have subtle impairments that require standby assistance with acknowledging other people's needs and perspectives and modifying plans. For level 9, that is purposeful, appropriate with standby assistance on request. So they respond effectively to familiar situations, but generally needs cues to anticipate problems and adjust performance, and they have low frustration tolerance. For level 10, that is purposeful and appropriate, and this is otherwise known as modified independent, and they respond adequately to multiple tasks, but may need more time or periodic breaks. They independently employ cognitive compensatory strategies and adjust tasks as needed.